Let's talk about the differences between baby blues and postpartum depression and what you can do about them. The symptoms of the baby blues are usually mild, and many mothers will describe them as mood swings, where one minute they are joyous and the next minute they are crying. Symptoms of the baby blues include irritability or overly sensitive, mental and physical exhaustion, sadness, crying for no good reason, anxiety, feeling overwhelmed or stressed, feeling restless, appetite problems, difficulty concentrating or making decisions, trouble sleeping or falling asleep, depressed, upset, angry with baby, partner, or other children, concerned that they can't take care of their baby, feeling empty or lonely, and feeling unable to cope. These symptoms can stress new mothers out and make taking care of the baby that much harder. It is essential that you remember these symptoms won't last forever. However, if the feelings make you scared or you feel out of control, contact your healthcare provider immediately. Please call 911 if you are worried about hurting yourself or your baby. The symptoms of postpartum depression can range in severity from mild to severe, but are usually worse than the baby blues. Feelings will often be more intense with postpartum depression, and postpartum depression will sometimes overlap with the baby blues. However, more often it's a continuation and a worsening of baby blues symptoms. Symptoms of postpartum depression include excessive crying, difficulty bonding with your baby or feelings of detachment, withdrawing from your partner, children, family, and friends, depressed mood, sadness, severe mood swings, feeling overwhelmed, decreased appetite or overeating, difficulty sleeping or sleeping too much, hopelessness, worthlessness, shame, guilt, restlessness, difficulty making decisions or concentrating, severe anxiety or panic attacks, intense anger, aggression, or irritability, overwhelming loss of energy or fatigue, feeling inadequate or like you're a bad mother, low self-esteem, reduced interest and pleasure in activities you used to enjoy, and lack of emotion. Sometimes symptoms will become extremely severe and mothers will experience suicidal thoughts, a preoccupation with death, or even wishing they were not alive. If these occur, you need to contact your healthcare provider immediately or call 911. The good news is postpartum depression is a disease that is totally treatable, and the length of the disease can be significantly reduced by seeking and receiving treatment early. Seek help early and don't be embarrassed. The causes of the baby blues are not 100% known, but it is believed there are many contributing factors that lead to the baby blues. The main contributing factor is the rapid drop in hormones after birth. Hormones are 20 to 30 times higher during pregnancy, and the process of childbirth releases hormones that create a chemical high in the brain. So, when the hormones drop rapidly, this can induce those feelings of sadness so many women experience. Other factors that can contribute to postpartum blues include sleep deprivation and fatigue, marital problems, stress, lack of social and family support, isolation, pre-existing medical conditions, being a young mother, and low socioeconomic status. There are several risk factors that can lead to developing postpartum depression. Despite common opinion that hormonal changes are the reason for postpartum depression, this seems to be a minor contributing factor, especially since many women develop postpartum depression long after birth. Instead, a prior history of postpartum depression gives you a 30 to 50% higher chance of developing postpartum depression again. Additionally, having a personal or family history of depression or other mood disorders is also a significant risk factor. Other risk factors include changes in thyroid levels, low vitamin D levels, anemia, stress or feeling overwhelmed, lack of emotional support, weak support system, being in an abusive relationship or relationship issues, lack of financial resources or financial uncertainty, sleep deprivation, unplanned or unwanted pregnancy, having twins, triplets, or multiple babies, difficulty with breastfeeding, and having a baby with special needs. Since the baby blues come and go so fast, often women don't even consider treatment because the first 2 weeks with a newborn are usually a blur anyways. The best way to feel better is to get as much rest as possible. Sleep when the baby sleeps. The more rested you are, the faster you will start to feel like yourself. Other things that can help are to connect with other new moms in your area. Avoid drugs and alcohol, which can worsen mood swings. Ask and accept help from family and friends. Start with light exercise like walking. Get some sunlight. Practice mindfulness and meditation. Make your relationships a priority, especially with your partner. And eat healthy meals and drink plenty of water. Another tip is to take care of yourself. This means don't worry about the housework or the laundry. Self-care is more important than home care. The baby blues should pass very quickly without the need for further interventions or medication. Postpartum depression is more severe than postpartum blues, so it requires more intensive treatment. To begin, every single treatment recommendation for the postpartum blues is also recommended for postpartum depression. In addition, there are several other treatments you can utilize for postpartum depression. These include talking about your feelings with others, engaging in individual therapy or marriage counseling, antidepressants, and estrogen replacement. It's extremely important as you're receiving treatment to check in with your healthcare provider often to ensure you are making progress. Additionally, avoid isolation, which can make symptoms worse and slow treatment progress. Very rarely, a condition can occur called postpartum psychosis. It develops suddenly, usually within the first 2 weeks after delivery, but sometimes in as little as 24 hours. This is a medical emergency and has a high rate of maternal suicide as well as risks of the mother hurting or killing her baby. The major symptom is loss of contact with reality. Other symptoms include delusions and hallucinations, suicidal thoughts or actions, confusion and disorientation, extreme agitation and anxiety, rapid mood swings, inability or refusal to eat or sleep, bizarre behavior and paranoia, and thoughts of harming or killing the baby. Again, postpartum psychosis is a medical emergency requiring immediate medical attention. This cannot be stressed enough. If a mother is experiencing any of these symptoms, you need to call 911 or bring her to the closest emergency room. Under no circumstances should she be left alone with her baby until she has received treatment. Treatment is usually done in the hospital setting. Baby blues is a common condition amongst postpartum women and is often mistaken for postpartum depression. I hope this has informed you on the differences between the baby blues and postpartum depression, what to look for and how to treat them. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.